Good day, I'm Dr. Dangleben, and this is the daily medical tidbit for the day, brought to you by Patient Choice in Chemin, Neuf, Pointe, Michel. This will be my last one for the week. I wanted to talk about something called Acnathosis Nigricans. Okay, it's a big word, but I'll put an image up and you will have a better understanding of what I'm talking about. It's actually a skin condition, right? And it's hyperpigmentation, where the area gets very dark and you have like velvety looking plaques, right? It's found in the folds of your neck, your axilla, your groin, where it becomes very, 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 very dark. In of itself, it's benign, right? But it's often a marker for some underlying problem, okay? So acanthosis is significant in and higher rates in morbidly obese patients, okay? And insulin resistance and also to type 2 diabetics, all right? And it disproportionately affects the Black community globally. It's not a Western thing, etc. It's global. Okay, acanthosis really comes from the skin in the top layer, and you have a large amount of melanin deposition. Okay, and the most common mechanism is actually hyperinsulin, right? Large amounts of insulin, excess insulin, right? Binding to receptors in the skin, and then that causes that darkening of the skin by proliferation of different cells, right? So you get this thick, dark skin with a velvety texture to it, all right? There's other causes, but that's the primary cause, all right? There are some cancers, especially stomach, gastric adenocarcinoma, right, can be associated with Acnathosis nigricans. All right, so remember, it's higher in dark-skinned people, whether you're from Africa, the Caribbean, wherever you are, you have a higher incidence of this, right? And in African American children in the U.S., it is reported that 30% of the obese adolescents, right, have that preceding the diagnosis of type 2 diabetes. So pay attention to that. The darkening of your neck, your axilla, your groin could mean more than just darkening of the skin, all right? So even your knuckles, and the perioral area, periocular around the eyes, all right? And again, I'm using these terms so I want you to get familiar with it. It's not that, I'm using big terms. No, we have to educate each other and learn these things, all right? So, and a lot of times within the acanthosis, you have a lot of skin tags, okay? So again, it's usually asymptomatic. It's just, it's visual. But sometimes you could have itching, the pruritus, and sometimes you could have an odor to it, okay? So just, it's a diabetic risk, all right? So it's, you have higher prevalence of insulin resistance, you have metabolic disturbances, and a lot of other things, and that can just be a sign of that, all right? So again, I just wanted to touch on that and let folks know, hey, it's not just darkening of the skin. There might be more to it. You might be pre-diabetic. You might be diabetic. So let's get used to making this diagnosis. And a red flag is if it happens suddenly and sudden onset, you have to think of a malignancy like a stomach cancer. Okay, so to the doctors, I say, you know what? Pay attention. Do the appropriate workup. Right? Get the A1C, get the blood sugar, Okay, if the patient needs an endoscopy, go ahead and get that, right? Especially if there is significant weight loss. All right, but remember all the things we talk about: diabetic control, losing weight, and all that. All these things will reverse that. I'm not gonna go into the skin creams and the bleaching and all that. We're not gonna get into that because I don't promote that. Although you might read out there, well, yeah, let's put that cream on there, and it might make the skin lighter, but that's not what you want to treat. You want to treat the underlying metabolic problem like the diabetes. Okay, I just want to put that out there. Acnathosis nigricans. All right, it's not just a skin issue; it's a visible marker of some metabolic problems. All right, have a great day, guys. Peace.